Hi everyone, I hope you're all fine. Today in this tutorial we're gonna answer a lot of your questions about what exactly blood pressure is, what are different factors affecting it, how can we alter it, what drugs are used to alter it, and the mechanisms with which they affect our cardiovascular system. If you have any questions, I'll be so glad if you let me know about them in the comments. Don't forget to subscribe us for more videos. Thank you. Okay, let's start. Okay guys, here we got this picture which has this red box, and by this red box I mean our conducting arteries like aorta or femoral artery or radial artery and every other artery which is before the tissues, but why have I just divided our arteries into two distinct arteries? That's because when in clinics we talk about blood pressure, we are actually talking about the pressure in conducting arteries, because the pressure in our tissues is variable depending on their need for oxygen or nutrients and several other factors. So what I want you to notice is that whenever we talk about blood pressure, we are talking about this pressure in our conducting arteries, the pressure that our blood exerts to the wall of such arteries. Now let's realize what really blood pressure is. What do we mean when we say our blood pressure is high or low, or it increases or decreases? Suppose this circle, assume this is a container with for example water in it. What are the determinants of the pressure that is exerted to the wall of the container by this amount of water? The fact is that the amount of pressure which is exerted to the walls of this container depends on, first, the temperature of this liquid, and second, the volume of that, the amount of that. So if the temperature increases, the crashes of these molecules to this wall of container will increase, and thereafter we will have an increase in our blood pressure or the pressure in this container. But that is not what really happens in our body, because our body temperature is actually constant, and it is, for example, 37 centigrades, and so this factor is not really important for us in clinics. But the other factor that really determines what our blood pressure is the volume of that. The more water that is just the more water that fills this container, the more pressure we will have. To wrap it up, what I want you all know that whenever we talk about blood pressure, consider that the volume of blood is the first thing that is important for us. Now let's get back to our picture. What are the determinants that just determine how much blood is in our conducting arteries? As you see in the picture, two factors, our heart and the blood that is sent to our tissues, determine how much blood, the amount of blood, the volume of blood which is in our conducting arteries. Here we got the equation. Our blood pressure is a result of the multiplication of the cardiac output and total peripheral resistance. Now let's determine and realize what role do these factors play in forming our blood pressure. Well, the more our cardiac output and the more blood our heart pumps, the more blood we'll have in our conducting arteries and the more blood pressure. So that's just physical, right? But what about total peripheral resistance? For example, suppose that you are exercising. Your muscles are just overactivated and need a lot of nutrients, fats, glucose, and oxygen in order to metabolize and meet their needs, right? So in these conditions, more blood must be led to these tissues in order to meet their requirements. So when more blood is when these tissues receive more blood, less blood will be kept in these conducting arteries. So as our total peripheral resistance decreases, our arteriolar constriction decreases, what happens is a piece of cake. Our blood pressure will also decrease because of the less amount of blood which is in our conducting arteries. In a nutshell, two factors determine our blood pressure: cardiac output and total peripheral resistance, the resistance of arterioles throughout our bodies. Now, let's consider different factors that affect blood pressure. As this equation tells us, every factor that wants to affect the blood pressures must either alter our cardiac output or total peripheral resistance. Now let's take a look at each of these options which are effective on our cardiac output. First is the sympathetic nervous system. We know that this sympathetic system can raise our heartbeat and heart rate from, for example, the normal 70 beats per minute to, for example, around 200 pulse per minute even. It can also increase the contractility and therefore our stroke volume, and thereby increasing the cardiac output by 2 times, right? For example, it can increase the cardiac output from the normal value of 5 liters per minute to, for example, 12 or 13 liters per minute. What about the parasympathetic nervous system? This parasympathetic nervous system also affects our heart rate. It can just decrease our heart rate. It can also decrease our contractility of and therefore the stroke volume, the amount of blood which is pumped out from each ventricle in each cardiac cycle, and thereby decreasing our cardiac output to, for example, even half, right? But what about the pulse self-adjustment? Let's talk about this pulse self-adjustment and Bainbridge together. Suppose that this is a graph of our heart, right? This is our heart, a simple oversimplified picture of it. This is the interventricular septum, the muscular portion, and this is our right atrium, right? Okay, what happens is that when our blood volume increases, what happens is super easy. Our venous return will also increase, right? and the more blood enters our right atrium. So what is the next step? What happens next is that our right atrium is stretched. This event itself is responsible for an increased rate of funny currents, sodium currents in this SA node in the wall of our right atrium. The result will be that this pattern in our action potential of the SA nodes will just turn into something like this, you know, because of the increased sodium currents. It just becomes like this, and therefore our cardiac rhythm will accelerate and the heart rate will increase. So the ultimate effect of the pulse self-adjustment is an increase in the heart rate. But what about the Bainbridge reflex? Again, in Bainbridge reflex, the venous return will increase, and as a result, some stretch receptors in the wall of our right atrium will be stimulated and will send some messages to our baroreceptor center in the brain, so that our sympathetic nervous system, via different mechanisms, increase the amounts of heart rate, and so our cardiac output again increases, right? So the last one is the Frank-Starling mechanism. In simple words, Frank-Starling mechanism says that the more venous return, the more blood which is returned to the heart, for example, consider the right ventricle, the more cardiac output and the more stroke volume. You know, there are many reasons and mechanisms behind this Frank-Starling law, which we will discuss later in a distinct tutorial. But just remember that this Frank-Starling mechanism means that the more blood which enters our ventricle via different mechanisms and because of particular reasons will increase the contractility and the cardiac output of our heart. Note that these 5 parameters are very complex and act through many mechanisms and different approaches, which I may discuss it later in different tutorials. For example, this pulse self-adjustment, Bainbridge reflex, and Frank-Starling mechanisms, which are all self-regulatory mechanisms, which are inherent characteristics of our heart, are all related to this venous return, as I told you, you know. And the venous return itself is a very, very, very critical point in the cardiac physiology, which I may discuss it later as well. So if you have any questions, please leave it in the comments and let me know which tutorials are most useful for you, so that I will produce them. Okay, now the last part of our tutorial is dedicated to TPR, total peripheral resistance, which is mainly determined by our arterial resistance. Either our TPR increases or decreases, our blood pressure will as well decrease or increase. What are some agents or what are some factors that increase our total peripheral resistance? Well, there are some physiologic factors like angiotensin and vasopressin, which are again so complex that need another distinct tutorial for themselves. They are very powerful vasoconstrictors, so they can increase our total peripheral resistance, thereby our blood pressure. sympathetic nervous system, while secreting different agents like norepinephrine, could again raise our total peripheral resistance, because they are as well some strong vasoconstrictors. Again, what are some factors that decrease our total peripheral resistance? First is the histamine, which we are already familiar with as an inflammatory agent, right? It just dilates our vessels. And bradykinin, the same, is again another just a factor that decreases our total peripheral resistance. Well, you see, these all factors that affect the cardiac output and total peripheral resistance could be all our target in therapeutic plans. We could, for example, use many, for example, drugs to block angiotensin receptors, so that it won't increase our total peripheral resistance and our blood pressure will decrease, right? Or for example, we might just transfuse some amounts of blood to a person so that his blood volume will increase, and a patient's blood pressure will increase as well. Okay guys, thank you for okay everybody, thank you for listening to me. Please subscribe us for more videos. Thank you.